Joanne DePrima is here, who actually, I've known Joanne longer than my husband, when we've been married 28 years. But Joanne's is a hairstylist extraordinaire, and she has shared her journal articles. I mean, we've really had a lot of conversations. Joanne's very much into hair restoration as well. And so from her being the expert in that way, we've kind of gone on this journey together, and also with her taking care of me with some of my own feeding issues. So you'll be hearing more from her in just a little bit. But as we're going on, Jeff, this isn't Ellen is. It's just a little delayed. Sorry.
Yeah, there is a
so
little
when
delay.
we look at hair loss, obviously it comes in a lot of different shapes and sizes and ages. We see it as far as certainly even people who are celebrity status are not going to be exempt from this. And every time when I see Prince William, if you've ever seen him by his daddy, you know, it's like, woo! And that's kind of, you know, some of the jokes there too is that's kind of crown balding, you know, but certainly there's some hereditary factors there as well. And when we look at, even with females, I mean, obviously you can, this is kind of bad styling to where you can see the hair pieces themselves, but we know that even the really tight braids, things that some of the styling factors that people do can also be damaging to hair itself. But as we're all trying to deal with it and kind of camouflage it in many different ways. So when we look at women's hair loss, it affects roughly 21 million women in the U.S. 65% will have noticeable hair loss by age 60. And so again, when you can look at kind of family history and then own personal history of seeing that increase. For men, about 35 million men in the U.S. are struggling with hair thinning or hair loss. 40% will have a noticeable hair loss by age 35. So again, what we're trying to do with our medical management of hair loss is get ahead of that game. It's just sort of like trying to prevent breast cancer. I don't want to be on the other end of that. I want to be on the front end of it. And being able to do the things that we can to prevent those things from happening. So when we look at this from our medical management point of view, we're going to be looking at a risk assessment with patients as far as they're going to be filling out detailed history forms for us. We're going to be doing education, which a lot of which what you're going to get tonight as far as how hair grows and that. What our treatment options are available. We're going to be tracking hair growth, and I think you'll be pretty excited to see some of the equipment that comes with this. This is just not like a, well, I think we're seeing something. I mean, this is going to be really quantifiable. And then follow up on that. So when we look at hair loss, we know that this is an emotional issue. Many people with hair loss experience a lower self-esteem. They may have fear, increased senses of fear, anxiety, illness itself of what's this mean for why that's happening to me. They may feel older than what they are because of the loss. They see themselves as less attractive because of their loss, and even to the point of avoiding social situations because of it. So we know it's huge as far as that social impact, and another reason of why we want to be very sensitive to that. But a lot of people have just given up, and they don't realize there's things out there that we can do, which is why we're all here tonight. So hair loss itself, the average adult head has 100,000 to 150,000 hairs and loses up to 100 of them a day. So if it feels like you just keep seeing more and more of this hair loss, indeed we do. And we also kind of go through some molting phases as far as kind of like what birds do. And many times I used to work in a very large OBGYN practice, and so I would get multiple calls a week about hair loss. And I would call Joanne and I'd say, Joanne, are we in a molt? And she'd say, we sure are. And it was just amazing that she was seeing the same thing in her salon practice as what I was in the OBGYN office. So looking at hair follicles as far as how they grow, again, we're going to be wanting to stimulate every aspect of this as far as from its nutrients, from its circulation. This one doesn't really show it, but you'll see it in the real life picture that hairs actually grow 2 or 3 of them together. They're not too widely spaced out like that. And this is to put it all in proper perspective, because it takes about 3 months to manufacture hair. And it was one of those things that kind of got my attention to myself this morning. I thought it takes 3 months to make sperm. It takes 3 months to wake up and grow follicles for the ovary. And now it takes about 3 months to manufacture hair. It's just kind of an interesting coincidence to me. But the different phases of hair growth, that anagen phase of 2 to 6 years of when it's actively growing. Canogen of 2 to 3 weeks when it's just kind of it's resting, kind of be one of those of trying to restore itself. And then that telogen 3 to 3 months before it's actually going to start to drop off and shed. So this whole thing is, again, not a really quick fix, because it's going to take us at least 3 months before we even notice that there's going to be changes. But it's exciting when that's happening. I mean, that's what the textbook case anyway is. So some of the things as far as what causes hair loss, and these are just some example of pictures, and there's going to be some amazing like before and after pictures with this. And Dr. Davis and I have spent some time with Dr. Alan Bauman, who is a hair transplant specialist in Boca Raton, Florida. And so he graciously is allowing us to use some of his before and after photos, because obviously we're just getting started. So we don't have ours yet, but we're using the same protocols as what he has done. So when we see these little circle patches, that is like when we look at the alopecia areata. And what's really interesting with that is that many times that's going to be linked with stress issues, and that as we can watch all that fill in, that's the fun part. And then we can get it from more of an androgenic, or the DHT is actually the thing that triggers it for both women and for men. We can also have where especially children will many times be pulling their hair out. When we look at male alopecia, so what normally happens is to see some of this frontal balding, it may be first, and that even as we're taking our before and after pictures, we're going to get them at different profiles like this. So we're going to get front on, we're going to get side, we're going to get crown shots. Because for most of us, especially for us ladies, we are going to be thinning up here on the crown. And men will start kind of with temple areas, and then kind of just in the back, and then many times move up in here to where it's total baldness. But you can see of where that androgenic male pattern for men, this is kind of typically how that progresses. So it is a hereditary male pattern loss. Again, the factors of it are that testosterone is converting with 5-alpha-reductase into DHT. And so many times what we're trying to do is to block that DHT. And the process that as it looks like we're seeing more and more scalp instead of hair is actually a process called miniaturization. So the follicles, their thickness, if you will, it looks like it's getting skinnier and skinnier. And as that happens, then what we see is more and more of the scalp itself. So this is looking from a hair cam, which is like it's connected to an iPhone, but it's like a magnification glass, if you want, as far as being able to look at the miniaturization. So again, you can see over here where like these little hair follicles, they usually come with 2 or 3 of them together. And so that whenever they do transplants and stuff, that's the way they plug them in, you know. I mean, it's being able to have that individual attention with that. But you can see the one on the left of how there's not as many follicles themselves, and then they're kind of more wispy, little skinny guys. And so that is that process of starting to become more and more of the hair loss. But the exciting part of it is, as long as we've got some follicles to work with, then we can help nurture them. So that, to me, that's tremendously exciting. So this is like another one of where you can see that, you know, where you see more of the white, the scalp, and normal hairs over there on the left, and then the right of where they just look like the fiber is actually getting thinner and thinner. And this is what the process of that whole DHT is doing. Females, as we lose hair, many things that are going to be there is, you know, the hormone imbalances. And again, that's when we see with menopause, with starting pills, with having a baby. Whenever there's been big hormonal shifts, many times ladies are going to shed hair. Polycystic ovarian syndrome, they just have a lot of androgen things to deal with anyway. And so thinning hair is going to be a pretty big issue for them. Hysterectomies, people who have a hereditary androgen sensitivity, because again, for women, this whole DHT thing can be an issue. So one of the issues that we want to look at is that a factor for her? Because then that affects treatment options. For myself, my father had a lot of thick hair, but my brother, all of my grandfathers, my uncles, they're all bald. And so I thought, I really probably have this DHT thing going on. So I did some genetic testing, and mine came back negative, which kind of surprised us all. So that meant that then the DHT blocking medications would not help me. So this is how we're not guessing, you know, we kind of test, we don't guess as far as what we're going to do. So different medications, and we're going to look at those. There's a lot of medications that cause hair loss. Illnesses, autoimmune diseases, again, kind of when the immune system starts to attack itself, and a lot of high stress, hair's going to go. Hair's kind of just as a resulting of that. Stress in our lives, and many times when, especially when you saw that picture of the little circles of hair loss, that is usually always when there's been a lot of stress. And I saw a lady not too long ago who had that the first time in college. She just really got stressed out with the whole scene of college. And hair came all back great. She was doing great. She came in again and it was back, but her husband had just recently been diagnosed with testicular cancer. And so again, for her body's stress response is kind of causing that to happen. So we want to address that and to be able to help people to learn different ways so that there's not as much cortisol or the other stress hormones on board. And definitely the type of nutrition. If we eat the typical American diet, there's going to be a lot of inflammation just in the food choices that we make. So for those of you who've been with us for a while, you know how we're trying to go down a different path. Environment, obviously, if we're around a lot of pollution, those sorts of things, it's going to have an impact. Our genetics, injuries, burns, often if there's a burn to the face, to the scalp, then there may be resulting loss in that area. And cosmetic procedures, you really want a good plastic surgeon if you're going to be doing some things, or else you may end up with a really funky looking hairline and other things like that. So it's you want to have them be thinking about hair as an issue when they even do this type of surgeries. So when we look at the hormones again, especially for women, the ebb and flow of that definitely has an effect as we're trying to grow hair. Both male and female parents influence a person's predisposition to male and female baldness. Pattern baldness, excuse me. And so again, oftentimes we may contribute it just to dad or just to, but it's actually both can be involved in that. So again, that the stress, the illness that we can all go through, thyroid disease, many times we will hear people talk about that their hair is thinning or their hair is falling out or their hair is really dull. There's been a change in the hair quality. When we're anemic, then we know that hair may take a dive, especially with ferritin levels, especially. Elevated cortisol. So the cortisol is that strongest stress hormone. So when we're stressed, it causes a lot of inflammation. As in anything that inflammation is always kind of enemy number one. So kind of the basement foundation of cancer, diabetes, heart disease, all the autoimmune diseases, and you can plug hair thinning and hair loss into that as well. So we're always trying to reverse inflammation and get that cortisol levels down. Sudden hormonal changes, we kind of talked about that a little bit. Medications that, as you can notice here, there's a lot of them that can cause hair loss. So the antidepressants, blood pressure medications, cholesterol, the statins, Hormone treatments, definitely if somebody has a testosterone, for women especially if they have a testosterone level that's too high, sometimes I'll start hearing about hair thinning. Birth control pills can definitely do it as well. General anesthesia, so I always try to tell somebody if I know that they're going to go in for surgery that this is one of the things that they may notice afterwards. Things like Accutane, the acne medications, weight loss medications, chemotherapy, blood thinners, antibiotics. Well, they're the stronger antibiotics, but many times those can be there as well. So when we look at the different treatment options of what can we do to try to correct the hair loss, one of them is looking at risk reduction. So where is this person going to be at most risk as far as losing their hair, and being able to try to do what we can to help to correct that. But we can certainly do that from some of the pharmaceutical agents that are out there, from getting our nutrients, so that we're basically trying to nurture hair from the inside out. So it's like if you were going to go plant your garden, you wouldn't just plant it from the first thing over winter. You're going to till it, you're going to give it the nutrients it needs so that then you can grow those vegetables. The same way, we need to give the hair the nutrients, get the cortisol down, give it everything that it needs to grow as well. Laser therapy we're going to talking about here in just a minute, and then also cell transplant therapies. So looking at that hair cam again, the main thing that we would utilize this for is for tracking the miniaturization, because as we're trying to make an impact on this with our treatment protocols, what we want to see is that these little hairs are going to get thicker, so that they're just not those tiny little wispies anymore. And that hair cam is just great to be able to show that to us. Another device that we're going to be doing is called a hair check device. And if you think about just trying to use like a little 1-inch square almost, and just almost like a ponytail check, it actually calibrates the amount of follicles that are in that little square, so that then in 3-month intervals, we're going to bring people back and we're going to do hair cams and we're going to do a hair check to see, are we winning the war on this deal? Because again, it's 3 months, so we're not going to see necessarily amazing changes, although I personally have been impressed that it can happen a little bit faster than that. So that's going to be a vital part of what visits for follow-up hair treatments are going to involve. Also, we want to help people to reduce and eliminate triggers that we know that for them may be causing loss, correcting any underlying medication. If somebody comes in here with hypothyroidism, well, we're going to want to right the ship with that before we would start doing maybe more aggressive things. Excuse me. And any medications correcting, is there anything that we can substitute them to that may not cause the effect on the hair? Their lifestyle choices. You know, with the anti-inflammatory lifestyle, basically what we all need to be doing, and this is thankfully it's not a different recipe for everything, but whether we want to avoid cancer or whether you want to grow hair and keep it, it's sleeping really well at night, not cheating sleep, getting some exercise, moving, helping with that insulin resistance and glucose metabolism, eating like a paleo-ish type of diet because it's an anti-inflammatory diet. So kicking the gluten and the sugars, dairy for a lot of people out, and eating foods that don't have inflammation to begin with. We may be doing some testing to find out, are there certain foods that are good foods, like for me, almonds and avocados, but my gut doesn't like them. So I need to really limit or stay away from that. And then stress management. So if it's somebody that's type A personality, they're just running off of cortisol, we're going to have a hard time, because that cortisol is just kind of blowing the torch to this whole thing as far as inflammation. Things that we can use as far as to block some of that, the DHT and the 5-alpha-reductase, we can use it in medications. We're going to use it in supplements that we give. We can also use it in shampoos and conditioners. So again, we're going to nurture the hair from the inside out. So from the supplements that we would encourage people to be on, as well as to things as far as with shampoos and conditioners. So trying to get that to stimulate the hair and to override that miniaturization, which actually happens, is again the anti-inflammatory lifestyle, sleep, exercise, supplements. I know it sounds like it's over and over again, but it's huge. It sounds like such a simple thing, but it's huge. So one of the things that we're going to do from the outside as far as topical medications and using, which we're going to talk about a little bit, scalp detox programs. There are things as far as like Nioxin, Aveda, have actually some detox programs that will help to get, it's like if you think of a detox for your gut, but this removes the oily buildup and allows that scalp to be a lot more pliable to intake of nutrients. The skin and the scalp are kind of end-stage detoxifiers. That's why you can do heavy metal testing from your hair, because it's worked its way out there. Shampoos, conditioners, again, the low-level laser stem cell. So finasteride, or what you may have also heard of, like of Propecia, is a DHT blocker. And so for both men and for women, if they have that androgen sensitivity, is certainly something that we can use to block that DHT. And then here's kind of some of Dr. Bauman's before and afters of just using finasteride by itself. So it's just kind of amazing to me when I look at these shots as far as, oh my gosh, that's just basically one medication that he was doing. Minoxidil, and this is a proprietary compounded form, not like the typical Rogaine type stuff, but is a topical medication. And again, just that by itself of what it can do. And the nutraceuticals, as far as we want to be using things from plant-derived, things that are bioavailable, that are going to get in and be able to really nurture the scalp itself, promote hair growth as far as with increased blood flow, and DHT inhibition, anti-inflammatory effects, increased nutrition because it needs it to grow. And then these are some of the phytonutrients that you will see in some of the products that we're going to be encouraging use of. And those that directly, because like the hair shampoo has saw palmetto in it, it has caffeine in it, things that even from on a topical point of view are going to be helping us to inhibit that DHT. So this one I'm very excited about. So it's low-level laser light therapy, and it basically is helping as far as to stimulate the mitochondria, which is the little powerhouse of the cells. They're like the electric power plant for cells. It also, there's many things, but some of them I find more fascinating than others. It also stimulates like their little erector pili. And I don't know if you know what that looks like, but if you've ever seen a scared cat, that's erecti pili at work. So it just helps those hair to be able to plump up and thicken. So some of these before and afters, as far as with just low-level laser by itself, 5 months of therapy. As far as, you know, looking at her crowning, definitely you don't see as much scalp that's thinning in the temple areas. And again here, again of the improved hair response from it. And so I just find excitement in this, that this by itself is actually doing that. And when you, and this lady too, I mean, I see this every day. And so it's just so exciting to know that there's things that we can actually do from a medical perspective to nurture hair and to have it to grow on its own. So one of the things that we have is, and as I've been talking to you, I've been doing a hair treatment. So some of you may have, inquiring minds may have wondered why I had a baseball cap on. But technically you could go shop and with this on, you could hide the wires and nobody would ever know that you were walking around and you actually had 265 laser diodes inside that are stimulating hair growth. So one of the things that I'm excited about this, and I'm kind of the office guinea pig on all of this, very delightfully so. But when I started doing this about 2 weeks, and it's 30 minutes a day for 3 times a week, And I went in to see Joanne, my first appointment, and because she's got those stylus fingers that can feel little tiny hair growths. And then my last appointment was just last Friday. So Joanne knows my hair very well. I would like for you to hear from her expertise.
Well, like Joleen said, she's been inquiring for many years after her hair started to get finer and finer. And 5 weeks ago, I think you came in and you had just used your laser cap for a couple of times.
Right.
And, I thought, well, there is some little hairs that feel like they're doing something, but we don't know what yet. Well, Friday when she came in, oh my gosh, I called over another stylist that has done Jolene's hair when I haven't been there. And the two of us really were very impressed because it's just like your picture shows. The hair follicle has more hair in it, and the diameter of the hair is stronger and thicker. Now, some of the hair is like very wavy, but we see that in people that grow hair back after having chemotherapy, where the hair is totally different. It's fine. It could be like lamb's wool, and they never had curly hair before, and you're like looking at them going, why the heck did they get a perm? And it wasn't that. That's the way it came in. Areas don't grow as well as other areas. You just really don't know how to help. But after seeing the laser cap perform on Joleen, I'm just really shocked because I've known about this for 20 years.
That's right. That's right. Well, thank you. And I can't really feel those little tiny little babies. And so that's where, I rely on Joanne's expertise for that. But it's been what was interesting in hearing their discussion was that it wasn't just in one area. It was in the back, it's in the crown. They were finding the little guys up here in the temple. So it's literally everywhere that the laser cap fits that was getting stimulated. So one of the things that we've kind of worked on too is just that scalp detox. And so that's definitely something that I'm going to be, that Joanne came up with that. Let's try this. And I think that definitely has been helpful. So I'm very religious about that. Once a month. You don't want to do it once a week or something that would be too rough on the scalp. But again, it just fits with what I know as far as skin and hair being an end-stage detoxifier. So if somebody's working with acne, it's inflammation. That inflammation is coming from stress or the gut. And so it just, a lot of this just kind of is fun to watch.
Okay.
Is the cap warm? I mean, do you feel any heat from it?
Yeah, it does. And I mean, you're supposed to be for 30 minutes. And so I'm ready to take it off in 30 minutes. It feels warm.
So you wouldn't want to wear it like walking outside today, huh?
Well, no, it's a little bit too valuable to have it blow off in the wind. But I mean, it is one of those things that's 30-minute sessions, and it's recommended 3 times a week. And many times the scalp gets really tight, and so what these detoxifiers do is make that scalp more pliable. And again, we want to help those little follicles to do their thing. So the laser cap is an option. There's also FDA has approved a handheld device. As well, it's one that you can buy it and it's on a stand. So there's other ways of being able to get that laser. So again, how are we going to evaluate this plan? Again, all of this is so individualized. Even the lab work to work it up is going to be individualized. So it's hard. We can't really say this is the price of coming in and getting hair treatment because it's so individualized to each person as far as what lab, what other conditions do they have going we need to address first. Everything like that. But that's what, in my opinion, that's what you want. You want this to be tailored to you, not just what everybody else gets. So we're going to be measuring the hair regrowth. We're going to use the hair cam, the hair check each time. Dr. Davis is not only amazing with his IT skills, but also photography. And so we've already set it up. I was the first guinea pig when I meant to see Joanne the first time, and she's like, oh my gosh, I'm already getting hair growth. I immediately came back here and we took some pictures because it's like, okay, we gotta get moving on this because things are happening. So I'm going to turn this over to Dr. Davis, and he's going to tell you the rest of the story here.
The laser cap, I didn't read the directions beforehand. I'm not a big direction reader. So when we got the hair cap, I was actually I wore it, I think, for an hour. And so I can say that you can safely wear it for an hour and your hair won't fall out. But that's not the recommended usage. But it did get warm. I was actually impressed with, you could feel the warmth in your scalp for quite a while. So Joleen came to me, I think it was over a year ago, and she really, obviously this was a personal problem for her, but it's been a personal problem for a lot of our patients. And so we kind of felt like we needed to find the person out there who's doing this right, and not just, there's surgical solutions everywhere. Everybody's got, you're going to hear about a robot that will automatically pull hair out and pluck it in, and I think the problem with those approaches that I always felt was that we're missing that key component of what's the underlying cause. And so in integrative and functional medicine, we always go back to what's causing this, what brought us to where we are today, and let's see if we can peel back some of those layers. Now, definitely, we're going to have patients that their only hope is going to be a hair transplant. And in that case, the surgeries are amazing. And we saw some work from Dr. Bauman in Boca Raton, and he really is the pioneer in the United States. And he's the international president of the Hair Restoration Society. I mean, the guy, his credentials are lengthy, and he's always looking for really the next best thing to help his patients. And this is all he does every day of the week. So we went and trained with him. So I wanted to kind of talk a little bit about platelet-rich plasma, I'm very excited. I've been interested in stem cell therapies going back about 5 years when I sat in on a lecture. I was at a conference and there was a bonus lecture, and they said, hey, do you want a free dinner? You can come listen to this talk about stem cells. And I didn't really hear what the talk was about. I just said, well, free dinner, yeah, I can. That sounds great. So I went, and I was absolutely blown away by what's being done with adult multipotent autologous stem cells. Now that's a mouthful. So stem cells are cells that can become many different things. And so if you think of a tree, the trunk, as it goes out, it changes into branches, it may change into stems, it may change into leaves. And that's maybe simplified looking at what a stem cell is. But I think stem cells get a bad rap because we always think of fetal stem cells. And actually fetal stem cells, the research is showing that they're not really doing that great with fetal stem cells. And there's a ton of stem cells actually sitting in this room, and all of us have stem cells. And every 7 years, our tissue is replacing itself. So you're a different person today than you were 7 years ago, and that's because your stem cells are still very active. So I was really interested in the adult progenitor stem cells and the ones that we could get from ourselves. So to me, it seemed like a really elegant solution to use our own tissue to heal our bodies. So this talk was fascinating, and that kind of sent me on this, I call them rabbit holes, because I just start reading and kind of, you can ask my wife, I'm sometimes up till 2 o'clock in the morning. She's like, what are you reading about now? Anything from stem cells to black soldier fly larvae, those are fascinating too, by the way, if you ever want to read about those. So I was interested in stem cells more from a standpoint of how they could help with joints, because we have a lot of people that have joint pain and their cartilage is wearing down, and joint replacement is expensive and it's risky, and it doesn't always fix the problem. And so there's lots of stuff going on in that area with stem cells. So platelet-rich plasma, when we talked about going and training with Dr. Bauman and found out that this is what he's doing, and I heard that he was using stem cells, I was like, oh, this is great. Because this is where the science needs to go. We need to be looking at how we can treat ourselves with our own, and really boost our own body's ability to heal itself. And this, to me, represents one of the finest examples of that happening. So I'm going to play this video.
There is a new hair solution to thinning hair for men and women.
It's a groundbreaking procedure being done locally that uses your own blood to grow hair. Chris Emma has more on the baldness cure revolution.
I just hope that I get a little bit of thickness, that I don't have to worry every single day about the wind blowing and a bald spot showing.
Denver Huey is just 38 years old, but she says she started losing her hair and thinning at a very young age.
It really became apparent in my early 20s, so very, very early in life. It's always been a very emotional sort of thing to deal with.
Denver says that she has tried everything, but nothing seems to work.
It seems like every male in my family is bald on both sides, on my mom's side and on my father's side.
Anthony is just 25 years old and is already thinning. Both Denver and Anthony are desperate to grow more and maintain their existing hair.
The density and the caliber of the hair is very weak. But the good news is that you do have some hair follicles up there that can be rejuvenated.
Dr. Alan Bauman of the Bauman Medical Group in Boca Raton uses a platelet-rich plasma procedure to help regrow and maintain hair, a relatively new procedure that has had good results.
This is a simple, quick, easy procedure that somebody could have on their lunch hour to stimulate greater hair growth.
After photos of the patient's hair and scalp from all angles, the target areas for the procedure are identified. Dr. Bauman says that Denver's problem is not uncommon. He says that years ago, his patients were about 90% males, but now about half of his patients are women.
We're really good at communicating now to women that there's something that we can do.
The patients get a scalp wash. And then it's into the chair for a local anesthetic to numb their heads so they can't feel the procedure. Then blood is taken from the patients.
This is the blood that we just took from Denver. It's going to be spun in the centrifuge and separated. What we're going to end up with is a platelet concentrate. So what we're looking at here, the red blood cells at the bottom, the platelet layer is in the middle, and the plasma up at the top.
The platelets and plasma are collected, and that liquid containing the growth factors can signal hair follicles to grow more and stronger hair. But the PRP is not the only thing in the syringe.
We're gently mixing the stem cells back and forth into the PRP.
And then Dr. Bauman uses a micropen after the PRP and stem cells are injected into the scalp to create what he calls microtrauma, or scratches on the surface of the skin so the PRP and stem cells can do their job. The procedure is quick, but the results take a little bit of time.
It takes a long time for hairs to grow. So we're going to see them on a monthly basis and track, measure how much hair is growing, how much increase in hair they're seeing.
For Denver and Anthony, it is going seeing results, but we do have some before and after shots right here from the Bauman Medical Group from patients of theirs in the past. You can see the dramatic difference over a long period of time.
It's funny, in Florida, I think every procedure is done over the lunch hour. They must have really long lunch hours there, because I know my lunch hour is gone very quickly. But I think it is impressive that it's relatively painless. Other than the injection. The first injection stings, but actually the type of anesthesia that we use, after that first little injection, they don't feel as you're going all the way around. I mean, it's really amazing. And I do this type of anesthesia with a couple other procedures that we have here in the office, and it's called tumescent anesthesia. And in fact, one of my patients is an anesthesiologist, and he remarked one day, I was inserting some pellets in his side, and he said, you know, my job is to not make people feel pain, and I don't understand how you can do this, and I don't really feel anything, because I'm inserting a trocar about that long underneath the skin and the fat layer, and he doesn't feel it. So really, when they say it's painless, it's virtually painless other than that first injection. So I talk a little bit about PRP and platelet-rich plasma. So when you notice they were drawing the blood off and they were using that centrifuge, one of the things, PRP is very dependent on how you harvest the plasma, because in the red blood cells are also all of the things that we need to create inflammation, coagulation cascade, all these inflammatory things that you do not want inflammation in the scalp. That would be very counterproductive to what we're trying to do. And I know this video is older, because the device that she's using is a micropipette, and she's having to micropipette the serum off, the platelet-rich plasma off, and try not to get even a single solitary erythrocyte, which is the red blood cell. And so it's very difficult to do with a micropipette. It's very dependent on the operator. And so we actually have a device now that we have a very fine control over that process, and we can actually get not only the serum, but we can get that very precious buffy coat of white blood cells that have a lot of those growth factors in them. And so we, you know, I think the science is always going to be advancing to make the harvesting of these much, much better.
When you mix them back and forth, you're not damaging any of the
Well, that's the other thing that's changed, is that our centrifuge that we have is computer controlled to very slowly spin that blood sample up, and we're very careful not to bump the blood and to break those little erythrocytes, because you're right, any kind of trauma like that can activate them. So the recommendation now is to no longer do this mixing back and forth, because even if one red blood cell got in there, it's going to cause those cells to activate, and we don't want it to activate until they're inside the head, where they can begin doing the healing process. So we use this very special computerized controlled centrifuge. It starts them spinning very slowly, and then when it stops, normal ones, they just have a break. I mean, clunk, and they stop, and even that can slam those erythrocytes up in the inside of that glass. And so we're rotating it very slowly to bring it back down. So, and there's not very many computerized controlled devices that can do that. So that took a little bit of time to find that. And then again, we're being very careful in how we manipulate that platelet-rich plasma, even once we have it separated from the erythrocytes. So the platelets are storehouses for a lot of signaling that goes on. It can actually enhance hair growth. And again, this is not going to be for areas of scalp where there are dead follicles. Dead follicles are gone. They're just little tombstones. There's nothing there. Those people will need to go on to transplant surgery. But what we're trying to do is to find those people that have those little miniaturized hairs, the really thin, wispy hairs that we can really work on. Because if we use the body's healing process and we've laid the foundation and really prepared that field, we should get good growth from that. So again, this whole idea is based on the healing and regenerative effects of the growth factors in our own blood. And there are more than 6,500 medical publications that are related to PRP. So PRP is being used in multiple areas, and we're finding that it's great for joints, it's good for burns, for tissue regeneration, for wound healing. There's just a ton of work being done in this particular field. Which is kind of amazing, because there's no FDA process involved in using your own body to heal yourself. And so therefore there's not a big company out there making a lot of money with a drug, and still the research is being pushed, because I think there's just pure scientists out there who are really interested in finding out how can we do this and really advance the science. So again, the quality is directly related to the specific harvesting technique. And this, I was kind of going through here, and I was going to bore you guys with what all these growth factors and cytokines do, but I guarantee you I'd put every one of you to sleep. But platelet-derived growth factor, you know, these fibroblast growth factors, insulin-like growth factor, all of these are growth factors that are present in our bodies that help us regenerate tissue. So when we've had damage, when we've had an artery or a finger that's cut, immediately the body goes and starts to heal those areas. So one of the reasons that Dr. Bauman is using that microneedling device, I'll pull it out and show it to you in a few minutes, is to create that signal, that micro trauma, to say, hey, we need some activation here. And by doing that as the last step, the scaffold and the platelet-rich plasma and all those nourishing factors are all there, present, ready to go. And it's really pretty phenomenal. Again, some of these are very specific to the growth factors for our hair follicles, and they stimulate very different parts of the hair follicle. And again, I think the anatomy slide of a hair follicle, the anatomy of a hair follicle is really amazing. I mean, how much, you know, sensory input that there is, and there's little tiny muscles that are in there. So there's a lot of different growth factors specific to that. So this is, again, courtesy of Dr. Bauman. We want to make sure everybody understands these are not our results, but I did sit down with Dr. Bauman, and I know that there's a lot of doctors who put their best pictures forward. And I've seen that before. So I asked him, I'd like to see your hard drive. And so I sat down and I flipped through, I don't know, probably 300-400 pictures. And he has some that look better. And he just, I haven't gotten up to updating slides yet, you know. So I know that this isn't just the cream of the crop that he's pulling. He really does a fantastic job with his photography. He makes sure that the lighting is consistent in each one. And that's important, because I think if you're a savvy shopper, you'll look on the internet and you'll see before and after pictures. And if the lighting has changed, or you notice that they're using hair product in one and not another, or they really changed the styling, your first question is, why did they do that? Are they trying to hide something or trying to cover something up? And so in here, he's not, the comb is there really just to show that she just has this alopecia areata, which again is a solitary area of hair loss. And this is amazing. So this was just PRP and also A-cell, which we'll talk about what A-cell is. So this is before and then 2 months and 4 months. And that's pretty phenomenal considering how slow hair grows. You know, usually when people have that kind of hair loss, we tell them it could be 6 to 9 months before you see anything come back, and certainly not 4 months before you have what I would say is
How long
almost...
does this last? Like forever or once a year?
Well, it depends on what the process was that brought you there. So and that's why it's so important to go back and figure out, okay, what was it that's caused this hair loss? And so we don't just start by saying, let's just inject PRP in everybody's head. We want to do that medical investigation to figure out. So if we fixed the thyroid, if we fixed micronutrient problems, if we've really addressed inflammation correctly, there's no reason why these hairs shouldn't just continue to survive. Now, as we all age, we do lose hair follicle, you know, size and thickness and number, but not like this kind of hair loss. And so one nice thing about the hair check device, which I've got right here, and this is, you know, I've had women come to me and say, oh, all my hair is falling out. And I'm sitting in front of them looking at them going, are you sure? Because it looks like you have a lot of hair. And it's really frustrating for them as patients. And I know that they've been frustrated with me because in the shower every day they're pulling clumps of hair out. And so one thing that was interesting that really impressed Dr. Bauman is that when women would say, I know that I can wrap my scrunchie around my ponytail 3 times more than I used to. And then that kind of piqued his interest. He's like, okay, well, there's something that we might be able to measure. And so he worked with, I think, a group of Germans to come up with this. You know, the Germans have all the good scientific equipment, right? So I put this on wrong last time, so it's not coming off very easily. So this is a hair check device, and so it uses a very specific caliper. And so we map out on the scalp a 1-inch square, and we pull that bundle of hair up and we separate it from all the others. And we have a very accurate way of measuring so that when we come back to that, we go to the exact same 1-inch square. And we are able with this device to basically put the bundle of hair inside there. And then once we've calibrated it, we can squeeze this down. And it's going to squeeze until it's, you know, hair isn't really compressible. I mean, it's keratin. And it'll squeeze down. It'll give us a very accurate number of what sort of the mass of that bundle is. And so when we first do the hair check, we'll actually compare hair on the back of the head, which normally is permanent hair. It doesn't thin over time or isn't as susceptible to thinning processes. And we can compare that number to the number on top. So if someone has a hair check of 250 on the back and a hair check of 125 on the top, we can say that's a 50% hair loss. Well, you can lose close to 40% of your hair before people start recognizing that you're having hair loss. And that, you know, at that point, it's sort of like that rock has momentum. It's really moving, and the hair loss sometimes becomes more rapid at that point. So this is a great tool for us to, again, as Joleen was saying, as we're doing all these things, we want to make sure, is it working? I mean, it's kind of hard. Hair grows very slowly, but with this device, we can come back in 3 months and we can actually measure not only the number of follicles, but as the health and the thickness of the follicles. Here's some just more examples of for alopecia areata, and this is again PRP with A-cell, and so this is 8 weeks and 4 months again. So pretty dramatic results. And here it is on a 36-year-old male. And so the extracellular matrix, so this is a component we haven't talked about yet, and it's something that when people were first starting doing PRP, they knew they needed some kind of extracellular matrix. The cells need something to stick to. And they were experimenting with various substances, and one that showed a lot of promise was actually using fat. And so they would actually suck out a little fat out of a love handle, and they would take the stromal portion of that, which is the acellular portion, and mix it back with the PRP. The problem when it comes to hair loss is that fat is really inflammatory. I mean, and again, we don't want any inflammation in there at all. So we've really kind of tried looking at other extracellular matrix that we can get, and there's a couple that we've kind of been playing around with. So what does the extracellular matrix do? It provides that framework. There's a biochemical support. There's molecules that are in there that actually help with wound healing and regulate communication between cells. So pretty amazing. So why would we use PRP with an extracellular matrix? And the main reason is that we can prolong and enhance the effects. And so the healing happens much more quickly. The effects last, you know, in I think his last study that he looked at was 5-year data. And the reason he said for up to 2 years was that his study had only gone that far. And so we're really seeing 5-year data. And so again, I think back from a functional standpoint, if you've fixed the problems that led you to there, there's no reason why you shouldn't consider that hair to be permanently better. And the hair growth effects seem to be a lot stronger. So, and again, we're checking that with the dermoscope. So this is a special lens that actually uses polarized light, and there's a microscope on here, and this device actually attaches to an iPhone, which has a really good camera. I've been using this to look at ticks lately in people to make sure they get the... Well, when they come in, they say they got the head out. I actually go and take a picture, and I can say, nope, it's still in there. So that's kind of nice. But we're going to be able to really measure the strength of the follicles and be able to see, you know, are we getting thicker, less miniaturized follicles coming out. So one of the things, A-cell, all of those were actually done, those before and after pictures were done with A-cell. And A-cell is a porcine bladder matrix. And a lot of you guys that are in our clinic know that I use a lot of porcine thyroid, which is a natural desiccated thyroid. We share an incredible amount of genetic similarity with pigs. So I don't know what that says about us as human, but so this is a micronized powder. It has collagen. It has the basement membrane. It's really the bioscaffold that is able to activate it. And since using A-cell, and A-cell's kind of claim to fame was this picture here, which this is an amputated finger. And so they were using this stromal substrate and I believe also using PRP. And this kind of image made it through the medical literature, and you know, a lot of doctors were just thinking, oh my gosh, this is amazing. And that finger regrew because of the stromal substrate. Yeah, so that you're seeing it amputated there, you're seeing it healed all the way in this picture down here. So it really is, I mean, we know, we've seen this in wound healing, and in fact the laser cap, that low-level laser light therapy, they were using it for wound healing. And as people's wounds were healing, they were growing hair in areas where they didn't grow hair before. So that's where we kind of said, hey, maybe that would work for helping people who are losing hair. So I think a lot of these discoveries that we make in science are accidental ones. So this is an example of that porcine bladder mix. BioD is another company that we work with, and their scaffold is a little bit different, and it's really unique. It comes from placentas. And the neat thing about placentas is that, well, number one, they're human placentas. Number two is that they come from healthy women, and they're considered medical waste right now. They're just, I mean, after a baby's delivered, that's the afterbirth, and it's just thrown away. And there's an incredible amount of extracellular material and matrix material that's in those placentas. So this particular company saw that that option, and they pre-screen. These are all from live births. These aren't from aborted fetuses. So they pre-screen women, they screen them for all these diseases, and then take the placenta, and instead of micronizing it or powdering it, they morselize it. So they're actually grinding it in a way that preserves even more of the extracellular matrix and doesn't disrupt that collagen and elastin that we have in there. The downside to this one is it has to be shipped in a negative 80-degree container, so the shipping costs are a little bit higher. I've looked at getting a refrigerator at negative 80. We're not there yet. They're pretty expensive. So the neat thing about this is it's immunoprivileged, and that there is not an immune system within the placenta because it represents an interface between mother and baby. And so it can't be something that the immune system is going to attack. So it works really well for what we're trying to do here. So again, nice natural scaffold. It's anti-inflammatory. It doesn't lead to scarring. And Bio-D really is kind of leading the way with this. And so it's being used in joints. It's being used in a lot of different things. I think the main thing right now is that the cost is higher on that one. So, but it's pretty exciting. So, well, the last thing I was going to show you, this little device that Dr. Bauman was using, that microneedling device. So this is the microneedling device, and it's hard to tell. You guys can come up afterwards and see it, but there's this little tiny tip on here that has, I believe on this one, it's 12 needles. And again, your scalp is numb, but this is what we're doing to create that micro trauma that's really going to kind of kick the whole process off. So
It's kind of similar to when you have, like, is it called Fraxel on your face skin, and it does those little needles or something?
yeah, so Fraxel is actually using light to create holes.
And then
Your own body comes in and heals it. Yeah. So it'd be amazing if you did Fraxel with PRP. I wonder what, that, I don't know if anybody's doing that, but that would be something definitely to look into, because then you're really just giving the body everything it needs to be able to heal that area. Well, we don't have a Fraxel laser yet, but yeah, that would be, I think, a fascinating area to look at. Other questions?